Hi there, I'm Jill Webb from Jill Webb Training. One of the courses I offer is first aid, and in the time I've been offering it, it's great to notice how many more defibrillators are available out and about. So the purpose of this short video is just to explain a little bit about these, how you might find one, and if you find one in an emergency, perhaps even more important, how do you use it? So, what's a defib? You might also hear them referred to as an AED, an auto external defibrillator. At their biggest and most powerful, they're the things that we see in Casualty on BBC, stand back, charging, putting the pads on the patient. Don't panic, the ones we use as non-medical personnel are a little bit, they're still very effective, but they're not quite as scary as that. Basically, a defib puts a shock through a patient to try to start their heart. The use of defibrillators has improved out-of-hospital survival rates massively. Getting access to a defib if somebody has collapsed and is not breathing is absolutely key. So one of the things you'll have no doubt been taught on your courses is when you make that 999 call, asking, is there a defibrillator nearby? Effective CPR plus a defibrillator can really improve chances of survival. The challenge sometimes is how to find a defib, and people look at me and think, what do you mean, Jill? They're quite big things. And up on the screens can be some pictures of defibs in different locations because they can look quite different, but it's really important that you learn to recognise them. Now, in an ideal world, the ambulance service would know where all the defibs are, and if you ring and ask, they will certainly do their best to help. But actually, in recent years, so many organisations have bought them, there may be one nearer than one that's registered with the ambulance service. And sometimes people say to me, Jill, that's really selfish. Why would you buy a defib and not register it? Well, for instance, I work with one firm that's quite high risk, so they have a defib in their factory. They always say, of course, if somebody else on the industrial estate came to use it, we would lend it, but we don't sort of make it publicly available because we need it here. We're a 24/7 factory. So it's really worth, and this is quite a nice bit of homework, go out for a walk around your local community and have a look. Quite often there is a defib in a sports centre. They're very, very often found on railway stations. Ask at your nearest supermarket behind the customer services. Get to know your area and where there might be a defib. And also get to know how to access it. You'll have noticed in some of the pictures, some of them have codes, some of them, one of them had a glass, didn't you? You had to break the glass to get the key, and the key unlocked it. Sadly, that's important because, as we all know, vandalism can be a problem. So find out where your nearest defib is by doing some footwork, by doing some chatting around the community. When you phone the ambulance or when an emergency happens and you're with your casualty, what you're hoping is that once you've started your CPR, somebody comes along and says, Jill, I've got the defib. Might be in a nice bag like this, might look all kinds of different things, but what we're looking for are the same things. And I'm going to show you that now. So what I'm looking for inside the defib are some kind of base unit. And that's going to be really obvious. Green for go, orange for shock. So you're going to know it's some kind of base unit. Some kind of cloth. Now, you'll know if you've watched my earlier videos, CPR is jolly tiring, but I'm sad to say this isn't to mop your brow. This is because casualties are not clean and tidy like my little Annie down here. They are messy, they've vomited, they're dirty. For a defib to work, the pads, which I'm going to show you in a moment, need to be on clean skin. So that's to get the skin clean. Pair of scissors. Defibs work on skin, so you're going to need to cut off any clothing. Quite strong scissors because, for instance, in a woman with an underwired bra, you need to cut through that. There's no modesty here because we're saving lives. Obviously, if you've extra people around, it's a great idea to get them screening the situation, but most important is that we save lives. You'll be glad to know I'm not going to cut Annie's jacket. I'm going to take it off. But in a real emergency, I would, of course, just cut the clothing. So let's just put that to one side. You may also find in a defib a shaver. Now again, this isn't so that I can just tidy little Annie's beard up before he or she meets her maker, because we're hoping the defib will save that. There are some gentlemen with very hairy chests. You may need to shave the chest to be able to safely and effectively attach the pad. And then you're going to find the pads really important. So this defib has two sets of pads, adult and child. Again, common sense, adult are the big ones, child are the little ones. We never use a defib on a baby unless we've been given medical advice to do so. So adult and child pads. Your defib may only have one set of pads, and if that's the case, it will usually have a button on here that you twist between adult and child. So I'm going to let you into a secret now. There's one thing to do if you find yourself in a situation where you use a defibrillator. Get everybody quiet and listen to what it's telling you. So I'm going to use my common sense, green to go.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
So it's telling me to apply the pads and then plug in the connector. So I'm looking on the pads.
Pads, plug in connector.
And they're showing you exactly where to put them. Apply pads, plug in
Apply
connector.
pads, plug in connector. Analyzing heart rhythm. Do not touch the patient.
So now you get your medical moment. Stand back, everybody.
Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now. Shock delivered. Begin CPR.
Wonder if you can guess what those beeps are for? So aren't they incredible bits of kit? What you've got to do is follow those instructions. So let's just have a look at what you do if you're using an AED on a child, and then I'll answer a couple of questions I get asked quite a lot about AEDs. So exactly as before, we're going to turn it on, but what I want to show you before I do is that these pads show something different. So if you recall, the adult pads we were putting here and here, because if you imagine where my heart is, we're trying to shock through it. The child pads we're putting on the front and the back, but you don't need to remember that. All you need to remember is look at the instructions. They will tell you or show you, like that does, really graphically what to do.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Analyzing heart rhythm.
So you can see this is
Do not
exactly
touch
the same.
patient.
Exactly the same as we did for the adult.
Shock advised. Charging. Stay clear of patient. Deliver shock now. Shock delivered. Begin CPR.
And we'll remember for a child, we're using one arm. So exactly the same and the same message. Get everybody quiet and listen to the instructions. Couple of things that I often get asked, or bits of sort of research to feedback. The first is that there's emerging research that says the more that we can make sure the gap between finishing CPR and shocking is kept small, the better the outcome for the patient. So if I was fortunate enough that somebody else brought along the AED, I don't need to stop, do I, and unpack it. They don't need medical training to be told, while I'm doing CPR, can you unpack it? Can you find a base thing? Can you find the pads? Yes, it means I might do 32 compressions instead of 30. I might get in a bit of a muddle, but I'm still doing some CPR. So keep the time between doing CPR and shocking as little as possible. And talking of the shocking, I spoke recently to a first aid trainer who'd used an AED. And I always say to people in that situation, what should I tell people? He said 2 things, Jill. Number 1, that time when it's analysing heart rhythm is only 20 seconds. He said, honestly, they were the longest 20 seconds of my life. I almost thought it broken. So I just thought that was quite a useful thing to pass on. The other thing he said is, although we know that a defib doesn't have the same power as one in the hospital, he said the body does still jump, and he was quite surprised by that. So hopefully there are a couple of useful things. If the AED tells you to, you carry on doing CPR, because we know our rule with CPR, we carry it on unless the patient has clearly come round. After 2 minutes, the AED will go through the cycle again. I hope that's been useful, and I hope, if nothing else, I've inspired you to get out for a walk later on today and find out where your nearest defib is to where you live and where you work. Thank you.